Do you frequently feel like your heart pains sometimes? Or maybe your hands and feet burn unexpectedly, even when you're not hurt? What if you sweat very little, even on a hot day? These might seem like separate issues, but they can actually point to a rare condition called Fabry disease. Imagine your body is like a recycling factory. Cells take in materials, use what they need, and break down the rest. In Fabry disease, one tiny machine in this factory is broken, so junk starts building up. Over time, this buildup harms important parts like your nerves, kidneys, and heart. It's rare but serious, and often missed because symptoms come slowly and look like other problems. So what breaks that recycling machine? It's your genes, the instruction manual you get from your parents. In Fabry disease, there's a typo in a gene called GLA. This gene tells your body how to make an enzyme named alpha-galactosidase, a kind of like a pair of molecular scissors that cuts a fat called globotriaosylceramide. Just call it GSL fat. When the scissors don't work, GSL fat piles up inside cells. Think of it like a clogged drain water, or in this case, fat can't flow and pressure builds. This gene problem is passed down in families. If your mom or dad has it, you might inherit it. It's X-linked, which means it affects males more severely, but females can also have symptoms too. Let's play a quick game. Raise your hand if you've ever felt burning pain in your hands or feet out of nowhere, maybe after exercise or a hot bath. That's a classic sign of Fabry. How about not sweating much, even when you're running or stressed? Another clue. People with Fabry often have small, dark red spots on their skin, called angiochrotomas, usually around the belly or buttocks. Imagine spotting tiny red freckles that never go away. Then there's belly pain, diarrhea, and trouble hearing. Later on, the fat buildup hits the heart and kidneys. You might feel tired all the time, a sign your kidneys are struggling or have shortness of breath. One man said, "I thought I was just out of shape, but my heart was being squeezed by this hidden fat." How do doctors find this hidden problem? If your story matches pain, no sweat, rashes, family heart, or kidney issues, they'll run a few tests. For men, a simple blood test checks if the enzyme scissors alpha-galactosidase A are missing or weak. For women, it's trickier. They might need a genetic test because their enzyme levels can look normal. Once confirmed, treatment starts fast. Enzyme replacement therapy, ERT, is like mailing new working scissors to your cells through IV every 2 weeks. Another option is a small pill like migalastat that helps the broken scissors work better, but only if your gene mutation fits. Add in medications for pain, heart, or kidney support, and many people live fuller lives. It's like fixing a leaky roof while also cleaning up the water damage. Can we stop Fabry before it starts? Not yet, but we can catch it early. Think of it like a family alarm system. If one person is diagnosed, doctors suggest testing close relatives, brothers, sisters, kids. In some countries, newborns are screened for Fabry using a heel prick test. Early detection is power. Imagine starting treatment before symptoms appear. It's like fixing the drain before the basement floods. While you can't change your genes, you can plan. Genetic counseling helps families understand risks and choices. So if someone in your family has unexplained kidney failure or early heart disease, maybe ask, could it be Fabry? Science is moving fast. Imagine a future where we don't just replace broken scissors, we fix the typo in the instruction manual. That's gene therapy, inserting a healthy gene into the body. Early trials show promise. One patient started making the enzyme on his own after a single treatment. Another advance is better chaperone drugs, like improved migalastat, that rescue more types of broken enzymes. Researchers are also using AI to predict disease progression from small changes in biomarkers. And wearable devices now help track pain and heart rhythms in real time, giving doctors live feedback. One woman said, "I used to feel helpless. Now my smartwatch alerts my doctor before I even feel pain." Hope is growing, one tiny step at a time.